Bismillahirrahmanirrahim. My name is Dr. Anwar Shahzad. I am the director of an hospital, Shahzad Surgical Hospital at Daban Bosan. So, we have started series of lectures regarding gynae mainly and other medical topics. So, today's our topic is malaria fever. So, malaria is so common that every layman, everybody knows it, and it is rather malaria appears in the form of fever. There are other kinds of fevers as well, but the fever, it is said that fever is not the disease itself, but it is presentation of some pathological processes going in the body. That is, in the body there is damage, there is process, prostaglandins are released, chemicals are released, chemical mediators are released, and so many other things. So, due to which, so because of these damages and going on in the body, there is increase in the metabolism as well. So it causes fever. So when it causes fever, we seek advice from the doctor. So we go to the doctor and tell him that I am suffering from fever. So he will ask you you will tell him the history, that how does it starts. So if you tell him that it starts with the rigors, it chills and starts even suddenly and causes headache, backache, and after a few minutes, it goes very high. There is high grade temperature. So the one wishes to have a blanket or of even the hot environment, although there is already hot outside, but he feels that the patient rather, is feeling chills. So he asks the audience attendants to put a blanket on him so that he may compete the chills and the rigors. So, but after a few minutes, so it gains, body becomes very high temperature, and he says that this take the blanket away, and now I'm sweating and other things. If we see the temperature on the thermometer, it is usually high grade fever. So this abrupt rise, this simultaneous rise, instantly rise, that occurs in the temperature, that may cause the brain damage and other organs, that is kidney and RBCs. So we have to treat the hypothermia, that is high grade fever, by putting sponges and paracetamol, and simultaneously we can send the investigations, and if a patient goes to the hypoglycemia, hypovolemia, and we give IV infusions, and accordingly treat him accordingly, and certain specific things, that is paracetamol corresponding and antibiotic drugs, but we can add the IV fluids as well, because he can suffer from hypoglycemia and dehydration. So what is the situation? The doctor, he will decide what additional things to be done. So it is endemic illness that is occurs in Pakistan and India. And so whenever there is a temperature with rigors, patient also tells himself that the fever started with rigors. So we will think of whenever there is a fever, high temperature, we will think of malaria first. Although we will take the history, the examination, the investigations, for others causes as well. So again, it is said, we can say that it is a very simple, rather very common illness, which can be treated very efficiently, and it has got simple medicines by which it can be treated. So it usually, this malaria occurs after 48 hours, but it can occur after fourth day and then daily. So if we see this blood film, and we can see the malarial organisms, that is plasmodium, which are four types. So with the out of them, Falciparum parum is malignant, and it may cause brain damage. So we once we have diagnosed, then the treatment is easy. We treatment of the cause, and the additional the supportive treatment is also needed. And but sometimes there is no a positive sign of in the body of malaria. It is because the when you take the sample, then the organisms are hidden. So when there is a spike, then you can take the sample, and you can mostly many times will have the organism positive. So this is a rather very simple treatment is done routinely, but sometimes it becomes as irregular symptom. That is, patient is treated, maltreated, and it does not give the typical picture of the malaria, and so the doctor can be confused. But even then, by their laboratory and history and organisms and this and being endemic in this region, we again and again think of malaria. So the malaria is if we see the malaria in the in the pregnancy, this is the hyperthermia which is damaging, which can damage the fetus. So when there is high grade fever of the malaria, there will be hyperthermia. So this is the hyperthermia which can damage the fetus. So we have to avoid the female to have high grade fever, and we can treat her timely and efficiently, and so that hyperthermia may not occur, or and it may not damage the fetus. So the treatment being, the specific treatment is the drugs, that is chloroquine, quinine, artemether, lumefantrine. So these drugs can also be given in the pregnancy, but out of pregnancy, which are contraindicated in pregnancy, are doxycycline, they can be given if in resistant cases. So we see that by if we see listen the history carefully and examine the patient, and see the laboratory investigations, we can efficiently treat this malignant disease, and a patient may recover. So mostly, although the patient they are treated, but sometimes because of irregular symptom, irregular preparation, and atypical preparation, the diagnosis cannot be made, and that can be uh, lethal. So, as we have seen, there is hemolysis. Hemolysis can release bilirubin, and bilirubin, when passing through the kidney, can damage the tubules of the kidney. So, it can cause renal failure. So, again, one we were said, we can say we should eliminate it, treat it on the very basic uh, step, that is nick the evil in the bud. That is, when this illness or any illness starts, you should or we should try to